Hello, my name is Dr. Mary Gray Johnson. I am a medical officer at the Edward Francis Moore Teaching Hospital in Banjul, and I'm also a member of the Pediatric Association of the Gambia. Today, the 19th of June, is World Sickle Cell Disease Day. It was established by the United Nations General Assembly in 2008 in order to raise awareness about sickle cell disease. Today, the 19th of June 2020, the Pediatric Association of the Gambia is celebrating sickle cell disease in order to continue raising awareness about sickle cell disease and its complications. What is sickle cell disease? It is an inherited disorder of the hemoglobin. It is also autosomal recessive, which means both parents need to be carriers in order for their child to have the disease. The disorder makes the red blood cells fragile and easily broken when exposed to certain unfavorable environment or conditions, which includes extremes of temperature, too hot or too cold, dehydration, infection, and certain drugs. What are the signs and symptoms of sickle cell disease? It is important to know that these signs and symptoms usually appear around 5 months of age and above, and it includes pain, anemia, jaundice, swelling of the hands and feet, dehydration, enlarged abdomen, and even stroke as early as 2 to 16 years of age. It is a severe condition, and it is a major cause of absence from school and psychosocial stress. How do we diagnose sickle cell disease? It is diagnosed by a blood test called the HB electrophoresis, which shows or determines the type of genotype. How do we treat sickle cell disease? Treatment is based on the presentation of the child at the clinic, and it usually involves pain management, treatment of the fever with antibiotics, depending if it's secondary to an infection, rehydration with fluids, blood transfusion if there is an indication, and for the stroke prevention, hydroxyurea is recommended, and monthly blood transfusion to prevent future strokes. How do we control or prevent sickle cell disease signs and symptoms? It is good to avoid exposure to unfavorable conditions which might predispose to the signs and symptoms of sickle cell disease. See your doctor in case your child has an infection or is in severe pain. Take medication as prescribed by the physician. It is important to rehydrate your child with enough fluids at home. Make sure your child has all the necessary immunization and regularly attend clinics. The complication of sickle cell disease is severe and can cause multiple organ damage. Therefore, it is important to know your status. Seek genetic counseling before getting married in order to prevent sickle cell disease. Thank you.